Next item is our 6.4 item, 9:45 a.m. Consideration of update on COVID-19, and I see Dr. Pace is here with us. Good morning, Dr. Pace.
Good morning, Mr. Chair. Good morning, supervisors. Here today to give the COVID update. So we have now in the country nationwide passed 500,000 people dying from COVID, which is a pretty remarkable number of people that have passed away. And so, we want to send out some appreciation and condolences to the families who have lost folks during the last year. It's been it's been just about a year now that we first started being aware of this. And, that's a lot of our neighbors and family members to have lost. So in Lake County now, we're continuing to see improvement. The vaccine situation is going to be the main thing I focus on today. We had shipment problems last week because of the weather around the country. The shipments did come in yesterday, so now we have a bunch of vaccine that we're preparing to get out, and we'll talk a little bit more about that. Sarah is not available today to come and give the epidemiologic report, but I will give a brief overview of the slides. So, Carol, if you can share those slides, that would be great. Thank you. So next one, please. So this again is the California graphics, and on the left side are the testing. So the testing numbers have gone down, but they're still quite high, really, just in terms of the validity of the testing. And on the right side is the test positivity. We're now at 3.3%. statewide. So this is the state testing positivity. And we were at something around 15% just a little over a month ago. So we're, 4 to 5 times down from where we were before, which is very reassuring. So next slide. The left side is the positive cases in California, again, dropping down. We are actually now down below the peak in end of July, early August, which was bad at that time, but now we see what bad can really look like. But we're continuing to go downward. On the right side is the hospitalizations, again continuing to drop. Next slide, please. And then the ICU on the left, and then the death on the right. The death rate is starting to drop now. We've had 230 new deaths daily in California, but they're continuing to drop as you would expect with the case rates dropping. Next slide, please. So this is Lake County. We've had, so you can see that we had that peak about a little over a month ago, and then we sort of stabilized at a plateau the last couple of weeks, and now it looks like we're dropping down a little bit further. So things are going in the right direction. We've had now a total of 40 deaths in the county from COVID. Next slide, please. This is the daily case rate now is at 15 per 100,000, under 25 per 100,000. The kindergarten and K through 12 can open. And we are now, the testing positivity is at 6%, which is in the red tier. The 15 case rate is still in the purple tier. We need to get, there was something like 60 to 70 cases in the on the chart there, and we need to be below 42 to get to be able to get in the red tier, and we need to stay there for 2 weeks. Next slide, please. So this is the vaccine update. So we're not a whole lot better than we were when I reported last week, because basically we had to stop the first doses last week because we just didn't have any vaccine. By the end of Friday afternoon, we had pretty much run out of vaccine. So we had to cancel all the first doses because we just did not receive any of the shipments last time. Now we're starting to get the shipments in again, and they're actually shipping what should have come last week plus this week. So now we have a double amount. So 8,200 residents have received 1 dose. That's 16% of the adult population. 2,600 have received the second dose. Next slide, please. Oh, that's it. Okay. So those are the slides. That's the update now. And so I just want to point out the case rate and the positivity rate continue to improve. The case rate still has us in the purple tier. We have a ways to go yet, but it's continue to go in the right direction. The issues with the variant, you'll keep hearing about this. The most important one, so the London variant or the UK variant, which is the B117, is starting to be seen around California and around the country. That's one's concerning because it does seem to be more contagious and more dangerous. We have not been aware of any of those of that variant up in our area. Now, there's one called the California variant or the West Coast variant. It's the B1427 or 1429, and that is spreading throughout California. In the Bay Area recently, they think that about 50% of the ones that they did genomic testing on had that variant in there. We don't know for sure what's going on with that one, but it seems to have similar activity to these other ones that we're watching around the world. It's probably going to turn out to be more contagious. So, which means that it will spread more easily. So the measures we've been taking before might not be as effective if we use them as they were before. So masking, social distancing, and all that. So it probably means taking extra precautions is a good idea as this spreads more and more around. We're not sure what the vaccine activity is against this variant. So we're just, more to be revealed. The state is testing more and more of the positive tests for the variants, and we're starting to see that this one does seem to be spreading pretty clearly. I only have data on 1 week in early January on this, and that was a quarter of the samples done in Lake County were positive for that variant. So the vaccine is the big thing to talk about today. And we still have the Moderna. We're getting more of the Pfizer coming in now. And another emergency use authorization is coming out on Friday for the Johnson & Johnson. And presumably they're going to go ahead and approve that one as well. So that will add a third vaccine to the arsenal. Supposedly they have supplies ready to ship, and they'll be coming out in the near future. So again, the shipments were blocked last week because of the weather. So we didn't get any new vaccine, and we basically used up everything we had left over to get the second doses of people that had already gotten their first dose. So we continued with those. That there didn't really wasn't a significant break in the second doses, but we did have to pause the first doses. So now we're resuming the clinics tomorrow. We finally got it yesterday afternoon, so we kind of had to wait till we had it in hand before we could start making the appointments, because we don't want to make 400 appointments for people and then have to call and cancel them when the shipment doesn't make it. So we got it. We're gonna basically, normally our schedule is Monday and Tuesdays in Lakeport and Thursdays and Fridays in Clear Lake. Because of this scramble around, we're going to do Wednesday and Thursday this week in Lakeport and Friday in Clear Lake. We're able to, there's more room at the Lakeport site, so we're going to go ahead and we can ramp that one up a little bit higher in terms of numbers. So then next week we'll go back to the normal scheduling of that. So we will be increasing the numbers of first doses this week that we're giving. So we're going to try to expand the site now because we do have more vaccine. And we're also going to share with some of our partners so that they can do it. So Safeway is going to get some, North Lake Pharmacy, Sutter's going to get some, and the Lakeview Clinic's going to get some. So we're kind of redistributing it around the county so that other folks can provide it. They have to be signed up a certain way with the state and the feds to be able to do this, but those folks have all gone through that process. And Adventist is getting some in through their own corporate structure. The drive-through is working really well. It seems to be good. Luckily, the weather's improving for us, and so overall, I think that's going to be the model moving forward. So there's some changes going on with the whole vaccine project. The state now is going to, you may have been reading about it in the news, but the state is going to put Blue Shield in charge of the vaccine rollout. And this is kind of a big deal, and we're not even exactly sure what all it means for us. They're basically, it's a big corporate structure that's used to managing a lot of data and a lot of patients is going to take it over. I think what that's going to mean is it's going to be a little harder for us on the local level to be flexible and provide for specific needs in Lake County, but we're not really sure yet. When we sat down and met with them last week, I know Supervisor Sabate is meeting with CSAC, and there's a lot of kind of engagement with the state around this, and they nod their heads and say they're paying attention and they're very concerned and everything. But I'm a little bit worried that they're not going to deliver on that as it comes. But we're doing what we can to advocate and kind of push for the needs of our community. The My Turn appointment scheduling platform, we tried it last week and there were a bunch of problems with it, so we closed it back down, but we are going to have to use it here in the next week or so. We've expressed our concerns about the problems. The main one was that they were allowing, they wouldn't screen out people from out of county from getting in to make appointments. So we're in a situation where we were only get a limited amount of vaccine because we're a small county, yet they were letting people come in from out of county to get the vaccine. And what was happening was they couldn't get appointments down in the Bay Area, so they just kept going to where they could find the closest appointment, and it was Lake County. So we had to turn away a bunch of people last Tuesday, and it was a pretty unpleasant situation for everybody involved. And I really appreciate the staff and the probation folks and everybody who was stepping up to do that, because, you know, it's really important, if we can, to try to reserve this for the folks, the vulnerable folks in our county that need it. So whether we're going to be able to continue doing that or not, it looks to me like the state is probably just going to open the doors and let anybody go anywhere. But this is, again, part of the discussion we're trying to have. And I just kind of wanted to give people a heads up that that's going on. The eligibility is another question. So currently what we're doing is focusing on the elders. All the folks in the 1A, the healthcare providers and the nursing home folks and everything have been done or have been offered it anyhow. But now we're focusing on the elders, and the teachers have been done for K through 12 as well. We're trying to incorporate in the farm workers so that we could start getting those folks vaccinated now before the season starts and before the new influx of workers comes in out of area. We're going to set up a new option for that on Fridays. Farm workers that need to get, they want to get appointments can call over to Lake County Office of Education. This is Angela, and let's see where the phone number is here. Okay, here it is. So Angela and her team will be, they're bilingual. They will be taking in folks that want to get appointments. Either they could drop by or call in, and the number is 262-4162. There's a couple other numbers, 4153, 4159. So it's 262-4162, 4153, and 4159. They'll call in on Friday, and they'll go ahead and register them online for some of the clinics in the coming week. So this is part of how we're going to try to do this. I'm not sure what's going to happen when the state takes over the whole thing. They may just open it up much more broadly, and we're not going to be able to target the more vulnerable groups, but we'll see how that plays out. That's still kind of a conversation that's going on. We've been considering mobile sites, but because of all this shipment issues and setting up the drive-through site, we just don't have the staff to do it right this second. But we're going to try to bring the farm workers into the stand-up testing sites. The ethics committee, which is a part of how we're trying to help prioritize this locally, has met now a couple times. And the way that meeting goes is they get data presented to them from Sarah around the ethnicity and the different kind of issues about who are the people that are highest risk. And then they're also receiving input from the public about what the public's concerns are. And then they're kind of discussing this, and then they give recommendations. So I wanted to just read the recommendations that they gave at the last meeting. So they're focusing on persons most at risk of death. That's the idea, to focus on that in terms of giving the vaccine. Continue to prioritize the vaccine to 65 and older, and the ag workers, with an emphasis on outreach and addressing logistical details impacting these populations. So that's what we're doing with Lake County Office of Education. Continue to offer vaccine to new persons at the homeless shelter. So we'll be working on that. And then for this week, hold off on vaccine to food service workers pending expanded efforts to vaccinate the above priority groups. And they say the committee readily acknowledges that the situation is very fluid and anticipates that its recommendations will change with each passing week. So, I think the important thing is to know is that these are a group of people that are really thinking deeply about the best interests of the whole community. And If people have input that they want to put in, they can send the email to the MOAC line, the MHOAC at lakecountyca.gov. Keep it under 200 words and say who you are and who you're representing and what your thoughts are. And then we'll get it to them before the meeting, and they'll take it under consideration. It's a good thing. I really appreciate the work they're doing. So a couple last things. One is for information on any of this. It's changing all the time. It's hard to keep up with it. You can dial 211. They have pretty good information. You can also dial the MOAC line, which is 263-8174, or email the MOAC line, and we'll be trying to get back to you. We've got some good staff that are working on that now. And for appointments. So we just opened up late last night the links again for appointments. The way to get an appointment now is to go on our website, Lake County Health Department, and there will be a link on there that you can tap on, and then you'll get to an online registration for an appointment. You need to be 65 and older now to get an appointment that way. That's the way it's set up. That's who we're focusing on right now as we try to get more and more of that population taken care of. We'll be able to expand more, or the state will take it over and do it the way that they're going to do it. If folks are having trouble doing the online thing, if they're an older person that doesn't have internet access or is having trouble working through the whole online thing, you can call 993-4644 and get some help there making the appointment. So the last thing I just want to talk about is, last week I gave information that I'm planning on leaving my position as the health officer in Lake County, and I'll be around probably till mid-April, so that everyone can find a person to take my place. And I wanted to just say that this has been a real privilege to be part of this. It's for a guy at my stage in my career. It's pretty important to be part of a pandemic like this, a response like this. I would have been very unhappy to have been sitting on the sidelines watching this go and kind of being an armchair quarterback. This was a really great opportunity. There's a really great team of leaders and staff here that are helping to respond. And one thing that came out, I read the article in the Press Democrat, and that had a slant that was not correct, and it didn't come from me. We had put out a press release, and I had a little bit of an email contact with them, but the way they framed the story of, lack of support and resistance to the public health orders. I mean, certainly, this has been a struggle, and there's no surprise to anybody here, but that's not why I'm leaving. We are at a new stage in the pandemic response. We've kind of been through this long, challenging crisis phase of a year long, and now we're really moving into a whole different phase. It's the state's going to be taking control and really laying out how it's supposed to be done, and it's going to be much more kind of navigating the state orders and kind of management of it, and sort of applying that to our local level. It's a little bit different than what my skill set is. I'm a doctor that's been working a long time out on the ground, and it's just time for me to go back and do that. But I just I was a little bit reluctant to see, or a little bit concerned when I saw that, and they mentioned some people that I'd had problems with and all that, and that did not come from me at all. That was probably historic, and I think they must have gotten that from their own newspaper articles from the past. And we've been working together as a team with the leadership in the county and with a lot of the agencies around the county in a good way. And I've been very appreciative of the relationships I've been able to form, and just the integrity which people have been standing up and trying to do the right things for the community. So I think that was probably all I wanted to say about that. But so anyhow, thank you.
Thank you, Dr. Pace. Any comments or questions from the board? Supervisor Scott.
Thank you, Dr. Pace, for your report. I just have two questions for you. One, that there's a little bit of confusion about second doses and the appointments there. they were, I guess, being told to wait for the health department to call them. Is that correct for their second dose if they don't have an appointment?
Oh, you're muted. Oh, he
Nope.
can't unmute.
Okay, thank you. You got me. Yeah, thanks. Right. Part of what's happened is because we moved the days and we moved the sites, what we had initially set up a month ago, has changed a couple times since then. So it's so they should get a call. I think partly what's happened, I'm pretty sure everybody's been called, but sometimes people don't answer their phone or they, whatever, they don't get it. Or if there's a problem, they should go ahead and email us at the Mohawk line or call and leave a message and we'll get back to them. What we are trying to do is call everybody who needs a second appointment. And if that's not happening, they should email or call us at the Mohawk line.
Great, wonderful, thank you. And then our compliance team, have we hired? Are we doing that? Where we are with that?
Yeah, the compliance team. So at this point, we have not been focusing on that. We did post it a couple months ago, and we basically things were the case rate was so high that we just did not have the ability to deal with that. And I think really, it wasn't going to have much impact where we were then. Now that the numbers are dropping, it may make more sense to focus on that again. We were just in the last couple of months, we've been scrambling as fast as we could just to keep things afloat. And so at this point, that's kind of been on pause for a month or so, just because we did not have the capacity to deal with it. Kind of where we're at now is most of the folks are doing what's being asked of them and doing the safe things. And then there's a small proportion of people that don't believe in it or are choosing not to do it and those folks, I'm not sure, that how much impact a compliance person with a low fine is going to really have on that. And so I think we sort of shifted our focus a little bit, but I think that's something that's at this point is probably worth taking up again from a public health point of view, because the numbers are down. We can actually try to contain some of these things, whereas before it was just so widespread in the community that there just was very little that was going to address. So I think that's probably a good question and something we ought to think about how to address within our team again.
Okay. Thank you, Dr. Pace. I just really appreciate you and your team and all the hard work. And I know myself and many in the community are incredibly sad to see you go, but well wishes on your next adventure.
Thank you.
Thank you, Supervisor Scott. Anyone else have any comments? Supervisor Crandall?
Yes, when you mentioned this just now, Dr. Pace, I actually looked online and seen I'm actually quoted, and at times I get called about these things and I answer, and it doesn't seem like everything I said was accentuated. And when it says it's really tough for him to take criticism and even sometimes the abuse, my comment wasn't that. It was more or less, we are elected officials on the Board of Supervisors. We're used to that type of abuse in comments in different threads. However, people that are hired aren't used to that type of, dialogue. And so this is the second time I feel I've been taken out of context, another one in a different article. So I want to apologize for that. That wasn't my intent to make you seem like a victim. I was just answering questions. And so, yeah.
I understand. No problem.
Thank you, Supervisor. Any other comments or questions from the board? Supervisor Pyska?
I have two questions. The first one is just pretty simple. Were the people that were being turned away last week out of county residents, or did they actually take the vaccines from our county residents who had to be turned away?
No, the ones on last Tuesday that got in because of the My Turn, they did not get vaccinated. The only people that I'm aware of, some of them had second residences up here. And so we did go ahead and give them some vaccine because they're, in the community. If they get sick, they're going to the hospital here. And so but the ones that that did not have any connection to the county were turned away. And there was a lot of unhappy people for that. But, especially as it turned out with the shipment not coming in and we had to cancel other appointments, I'm really glad that the staff just held their ground. They did a phenomenal job of really kind of digging in and protecting the county vaccine supply.
That's good to hear, and it's unfortunate that they were upset that they were trying to game the system. So, the second question I have is, in the news, it's been stated that the state is going to be withholding 10% of vaccines for educators, and we've already done that. So is that going to affect our allotment?
It's really hard to know what that's about. He's just sprung that on the public. There's not been much discussion in my world about what that means. My understanding is I'm not sure. I kind of think it's not changing our allotment. I think what it means is that we have to demonstrate that we are vaccinating the educators. And, we haven't done all of them. The childcare workers and the college folks have not been vaccinated, but the goal here was to open the schools, and the K through 12 are the ones that have not been opened. The childcare and preschools have been open, and the college is not planning on opening this semester. So it seemed to make perfect sense for what our situation was to really focus on that. I'm not sure how that's going to play out now. I kind of think it's not going to affect us too much. I think it's going to be kind of like a reporting issue more than anything else.
Well, I do appreciate you making the educators a priority, and the timing is working really well with so many of the districts opening up. So that was a good call. I do remember being in the boardroom last February when you came in for the first time to speak on the virus that was in China. And a lot has happened this year. And I just want to thank you for your grace and compassion over this last year. And I know it was difficult, but we all really appreciate your work and your dedication to looking after our most vulnerable. And we'll always appreciate you here in Lake County.
Thank you.
Thank you, Supervisor Pesca. Any further comments or questions? Supervisor Simon?
Yeah, just, obviously, I want to thank you for your service to the county. Moving forward, obviously, with the variants, with the vaccine, the way it's coming out, we'll just continue to support the public health department as we move through this process and you while you're here for between now and April. But, I just want to thank you for the work that has been done, especially over the past year in dealing with this pandemic. So other than that, that's really what I have today. And I'm glad that the vaccines got through after the storms and we're starting up again, because that is making a big impact on the emotional, feelings of our elders here in the county. And I know I've been reached out to by multiple folks that have gone through the process, whether it's in Clear Lake or the drive-through, getting their vaccines. And they were very thankful for the professional manner that was put together. And, hopefully we just continue on that good path forward over the next few months. So thank you very much.
Thank you, Supervisor. I have a few questions. One of them is maybe a couple of them are comments. You stated that K through 12 can open. I believe that's only K through 6. That 7 through 12 needs to reach another level of 7 or 8 per 100,000 or something like that of caseloads, new caseloads, before they can open. Is that correct?
Right. So K through, I'm sorry if I was confusing. What I was meaning was K through 12 is not open now, and much of it, and that's why we were focusing on that for the vaccine. Yeah, at this point right now, K through, if somebody was open prior to going into purple, they can open back up. Now that we're in purple and we're under the 25 per 100,000, K through 6 can open up if they have the safety plans in place. Middle school and high school are not able to open until we're in the red zone again.
Correct. I will say, and I know last week I talked about my support for opening up our schools. There is an updated website on covid19.ca.gov that shows you a map of all the schools that are open, the ones that are in hybrid, and the ones that are just distance learning. And the difference between private school and public school is disturbing. We have not heard horror stories coming from our private schools, and some of them are right here in Lake County as well. And yet we're still struggling to get to a point where we feel comfortable to open up, or where the boards of schools feel comfortable to open up. And I just, there's such a difference between who has access to a private school versus who has access to a public school. And this is, I'm very worried as we keep going with COVID-19 about the lasting effects of what this will have on our communities between the haves and the have-nots, and how they have been treated throughout this. And that brings me to the vaccine clinic, where we're seeing that same exact scenario coming down, where we're inviting sectors of our economy. And we're inviting that sector because some of their workers are very vulnerable to obtaining or getting the virus because of their workplace scenarios. And what we're seeing is office staff and upper admin coming through, and that's just a problem. It's kind of disgusting. Spoke about it last time, but humanity is really coming out in a very bad way for many different things here. Want to talk about real quick the TPA, the third party administrator of Blue Shield. I share your concerns, Dr. Pace. The entire CSAC group, almost every county in the state of California, is against the TPA. It's just a new entity coming in and basically in a very rude way saying, hold my beer, I got this, when we've been dealing with it the whole entire time. We know our community better. Blue Shield is not in our community. Yes, they do have some folks who have them as an insurance company, but they're not here. And for them to think that they can just come in, ask us to step aside and do the job that we're doing, maybe they can bring more capacity than what we have. But what I've been asking the state and just letting the board know is that they need to work in collaboration with public health, not take over public health and what they've been doing. If they can be partners and provide some extra assistance, I think that would work a whole lot better than them thinking that they have better access or better connections to our community than our public health does. And again, that's across the board in CSAC. CSAC has written letters to the state of California saying, who came up with this? Nobody wants this. Why are you doing this? It's one of those things that, again, we can't explain necessarily the governor's reasons for this, other than he must think that this is the right thing to do, or his group of people that thought of this think it's the right thing to do, but no county seems to be in favor of it. Another example of that is the My Turn. I just want to, I guess, apologize to our staff for putting them in a situation where they have to deal with people yelling at them, people crying, and almost to the point where people were threatening our staff because they've traveled 3.5 hours to come get a vaccine that they legitimately signed up for because the website allowed them to, only for us to tell them no. I am so thankful that we said no, but that situation should never have occurred. And so that is very upsetting. And that's, again, an issue of the state saying, I got this, or not really. We're hitting another wall with that. I agree also with Dr. Pace that it seems that we're aiming towards everyone for themselves to get the vaccine eventually. I hope that is not going to be the case, but I just don't know another scenario of how that's going to happen when Blue Shield comes through. And I see that as being a Lord of the Flies situation where, again, the haves versus the have-nots are going to get access to these things first compared to everyone else who won't. And I think that us as a local jurisdiction have better capabilities to ensure that the right folks get access to the vaccine in the right order. If it was unlimited supply, then nobody would care. But our supply is very limited. As you can see, I looked on the California website. It says we have over 10,000. Dr. Pace showed us today we're over 8,000. I don't know if they put both those numbers together, first dose and second dose, to get their 10,000, or if they're getting the numbers aren't jiving 100%. But either way, we're far from where we would like to be. And this situation is only exacerbating more problems, not healing and resolving some of the problems. I want to bring up enforcement because it was brought up. And I understand that we had such a surge that there was, that it was overwhelming to look at what enforcement would be or look like. But I can't help but feel, isn't that when we needed the most enforcement? Because the idea was to control the virus, and when it's out of control, we're choosing not to control it, versus now that we have less, we're going to control it. So I think we need to review what this enforcement looks like, because I just, if we're gonna say we're gonna enforce when it's light, but not enforce when it's heavy, I'm kind of doing an analogy of what would our law enforcement do if there was a lot of certain types of crimes versus a little bit. Are we going to ignore it because there's a lot, but not ignore it when there's a little bit? And I think we need to have that same stance, and maybe find different ways than just putting it on the lap of public health to get to the part of enforcement, or else maybe we don't want enforcement. I don't know, because it's confusing to me that the idea was to control it, and yet when it's out of control, we're not controlling it. And yet at the same time, we've asked businesses to shut down in order to help us control it. So it's all very, it becomes a very confusing scenario and situation of we're saying something, but we're not doing something. And so I think we need to review and see what it is that can be done better, or just not done at all. Because if we're not doing it when it's heavy, it doesn't make sense to do it when it's light. I'm confused by that, and I'm not comfortable with that. And so I think that we need to have that conversation. I do want to say thank you to two specific people. One that I met over at the vaccine clinic. I went by over at the city of Clear Lake. I believe it was Thursday. Spoke with Dr. Pace, who kind of walked me around, showed me exactly how everything was working with the new drive-through scenario. I don't remember his last name. Dr. Pace, you're going to help me with that. But his name is Larry. He works for public health. And I know that he had to deal with some of those folks that came from out of county. And again, dealing with those emotional pleas, whether they're crying because they feel desperate to get the vaccine, or yelling because they're upset that they felt led astray thinking they can get it, or worse, which he had to deal with. I just want to thank him for doing the right thing, having the right attitude, and trying to de-escalate those situations to the best of his capabilities. Again, not something that I anticipate we should be putting our staff in that situation, but the fact is our staff was, and so I want to make sure and highlight him and say thank you. Can you provide his last name, Dr. Pace?
Platts, Larry Platts.
Thank you very much. I should have known that. Larry Platts, I just want to thank Larry for that. And then last, I want to thank also Willie Cepeda, Chief Cepeda. He is, I sent him a private message, but I want to do this publicly as well. He's been a part of this every step of the way, has been an absolute partner every step of the way. When I was volunteering at the testing sites early on in springs, maybe early summer, he was there just about every single day, helping to get swabs and getting specimens sent out. And he's doing the exact same thing with the vaccine clinics and helping to get those shots into arms. And that is on top of the actual job that he has of being the fire chief for Station 70. So I just want to thank him publicly, because he has absolutely been a huge part in providing assistance with everything that we needed to get done. And Dr. Pace, the situation that you came in was not the situation you eventually received. We had a much more calm environment for you. We were talking about tobacco cessation. We were talking about how to increase our health numbers. And then this happened. I don't think that there's any public health officer that was trained or taught specifically by textbook on how to deal with this. I think everybody learned while building the airplane and trying to learn from one another. And I know that your job as of March of last year became incredibly difficult. And so thank you for your hard work. I know that the public and the board didn't always agree with you, but that is the way of a democratic process. But I do appreciate that you stood strong with what you believed in and that you followed through with what you said you would do. So thank you very much for your time here, and best of luck as you transition over to your next step. And I know that we have until at least, possibly longer, till April 16th, and we'll have a further discussion on what the board's next steps will be. But thank you very much for your service. Any other comments or questions before we open it up to the public? All right, Jake, can we please open up the Zoom room?
All right. I've sent an unmute request out to the Zoom room floor. If you'd like to make a comment, please unmute and state your first and last name.
Christian Thomas.
Yes, please.
Just wanted to thank Dr. Pace for his tireless work for trying to keep the community safe as much as possible throughout this COVID pandemic. And, you know, your reports on a weekly basis are very informative of the public, even though some may have disagreements, some have agreements, but I really appreciate you, Dr. Pace, for really sticking it out as much as you could. And I'm really sad to see you go, but I wish you the best of luck in your future endeavors and enjoy the rest of your career. And Lake County was very proud to have you. Thank you.
You, Mr. Thomas. Any other public comment?
Hi, I have my hand up. Can you hear me?
Yeah, we can hear you. Go ahead, Sally.
Okay, hi. Hi, this is Sally Peterson. And I just wanted to say to Dr. Pace, thank you so much for all you've done in our community, especially with our Indian community. You and your staff always went above and beyond, answered a lot of questions when we had situations come up at our casino, and even with our governmental employees, and the collaboration that you had with all of the tribes in Lake County on the Zoom calls that we were doing, and just over and beyond, really with working with us. And I don't know if anybody else, hopefully that will continue with the new person, but it was just much appreciated. And we really appreciate all that you've done, Dr. Pace, and your staff. And I wish you well. You're a really good person and very nice to work with. And I just wish you the best. So thank you so much.
Thank you, Ms. Peterson. Any other public comment? Okay, hearing none, let's go ahead and bring it back to the board. Any further, Supervisor Crandall?
Yeah, Sally reminded me of something, and I wanted to highlight that. Dr. Pace, I know that there was some time frame, I was still serving as the tribal chair for Robinson Rancheria, and we had quite a few different scares. And during that time frame, you were very hands-on. We got you in touch with tribal health, worked together on a lot of those key issues. Of course, we were all working on the same initiative, and that is making sure people are safe, making sure we took care of the, social distancing or the way that we would handle programs, even the opening of the casino, things of that nature. you're always willing to work with us, and any other business, even when it came to the Blue Collar Committee, meeting with them and talking with them about trying to keep open. You met with both sides of people that were afraid of the pandemic, and then you had a group of folks that really didn't consider it a pandemic and just wanted to keep opening. And you worked with them. I mean, you sat with them and tried to find ways to do things. And just wanted to highlight that you've always tried to work with everybody. And again, I want to apologize for the way that article portrayed, because that wasn't my intent. My intent was just to say that I'm super bummed, and went as it was. And so, again, thank you for all the help you've provided for not only Lake County, but the Indian community as well.
Supervisor. I forgot to mention one thing. I had a question. So we did 2 contracts, and one of those 2 contracts, and that was an equity contract, I believe. One of them was with LCOE for the Latino communities. Are they providing some assistance with the vaccination, looking to get farm workers vaccinated? Are they providing any assistance with that, or is that a separate charge that they're on? I know they were all about messaging and trying to get cases to come down in the Latino communities. Are they providing assistance with the vaccine?
Well, right. That's the thing I was mentioning before. So Anna Santana and Angela Cuellar are the 2 leads with that. And they're really at the intersection of public health, trying to engage with the Latino community to keep the cases down and to get the vaccine out as well. So they're actually stepping up, and they're going to be helping us register folks as part of this RFP, as part of this contract, to really try to bring in folks and get it done in a skillful way where we can kind of target the most vulnerable folks.
Okay. Thank you very much for that answer. Any other further comments or questions from the board? All right. Dr. Pace, thank you very much for your time, and we will see you next week.
Okay, thank you.
Thank you.